Hi, before starting, I would like to kindly ask you a courtesy. If you find the contents of the video interesting, subscribe to our channel and like it. It doesn't cost you anything, however, it is very important for the channel to be considered by YouTube. Thank you very much if you support our work. Ever wondered why that bump on your big toe is causing so much discomfort? Could it be a bunion? Bunions are a common foot issue, and they can turn a simple task like walking into a painful ordeal. But what exactly is a bunion? A bunion, medically known as hallux valgus, is a type of foot deformity. It occurs when the joint at the base of your big toe pushes against the next toe, leading to a bony bump on the side of your foot. This bump is the bunion. While it might seem like a small issue, it's more than just a cosmetic concern. This deformity can cause significant discomfort and even pain when you walk or even just stand. Bunions tend to form gradually over time. The exact cause is often difficult to pin down, but it can be due to an inherited structural defect, an injury, or even certain types of arthritis. Some people may also have a higher risk of developing bunions due to their lifestyle or choice of footwear. For example, regularly wearing high heels or shoes with a narrow toe box can put undue pressure on your toes and potentially lead to bunions. However, it's important to note that not all bumps on your foot are bunions. There are other foot conditions that can cause similar symptoms, but require different treatments. That's why a proper diagnosis is crucial. If you're experiencing pain or discomfort in your foot, it's always a good idea to consult with a healthcare provider. So, if you've noticed a bony bump on the side of your foot, or if your big toe seems to be leaning towards the rest of your toes, you might be dealing with a bunion. But don't worry. There are many ways to manage and treat this condition, from simple lifestyle changes to surgical interventions. This bony bump might be more than just a nuisance, it's a bunion, and it's time we learn more about it. So stay tuned as we delve deeper into the world of bunions in the next segment. So what causes these uncomfortable deformities? You might be wondering. Well, the development of bunions is often the result of a combination of factors. Firstly, genetics play a significant role. If your parents or grandparents have bunions, there's a chance you might develop them too. This is because some people inherit a particular foot type that makes them more susceptible. Secondly, let's talk about footwear. Shoes that are too tight, narrow, or high-heeled can exacerbate the problem. They put excessive pressure on the toes and can accelerate the formation of a bunion. This is one reason why bunions are more common in women, as they are often subject to the fashion demands of narrow and high-heeled shoes. Next, certain health conditions can also contribute. For instance, people with inflammatory conditions like rheumatoid arthritis or those with neuromuscular conditions may be at a higher risk. Moreover, if you've had a foot injury, it might alter the way you walk and put more pressure on the big toe, leading to a bunion. Even lifestyle factors can be a cause. For example, if your job requires you to be on your feet all day, especially in unsuitable footwear, you might be more prone to developing a bunion. Last but not least, age is another factor. Bunions often develop later in life as the foot spreads and ligaments soften. However, it's important to note that while these factors may make someone more susceptible, they don't guarantee that a person will develop a bunion. Everyone is unique, and so are their feet. By understanding these causes, we can better appreciate the importance of proper foot care and footwear. It also helps us understand why certain people might be more at risk than others. But don't worry, even if you find yourself at risk, there are plenty of ways to manage the condition, which we will explore in the following scenes. Understanding the causes can help us take steps towards prevention and treatment. So keep watching, because the journey to healthier feet is just getting started. Are you wondering if there are ways to alleviate bunion pain without resorting to surgery? Let's dive into the pool of non-surgical remedies that can help deal with this discomfort. First off, orthopedic inserts. These are specially designed shoe inserts that can help redistribute your weight more evenly, taking the pressure off the bunion. They can also help realign your foot and reduce the strain on your big toe. It's like giving your feet a well-deserved break. Next, we have specific exercises. Just as you work out your body to keep it in shape, your feet need some love too. Exercises such as toe stretches, resistance training, and toe curls can help strengthen the muscles in your feet and improve their flexibility. These exercises can be done in the comfort of your own home and can be easily incorporated into your daily routine. Think of it as a mini yoga session for your feet. Last but not least, let's talk about footwear. Your shoes play a significant role in how your feet feel at the end of the day. Wearing comfortable shoes with a wide toe box can give your feet the space they need. Avoid tight shoes or high heels as they can exacerbate the problem. Remember, comfort is key. While these non-surgical remedies can help manage bunion pain, it's important to keep in mind that they may not correct the underlying problem. They are more of a supportive measure to keep you comfortable and active. And of course, it's crucial to maintain regular checkups with your doctor or a foot specialist. They can monitor your progress and suggest adjustments to your treatment strategy as needed. So there you have it. Orthopedic inserts, exercises, and appropriate footwear can be your allies in managing bunion pain. These remedies can provide relief and improve your quality of life, but sometimes they might not be enough. If your bunion pain persists, it may be time to discuss more invasive options with your healthcare provider. But that's a topic for another scene. When non-invasive methods aren't enough, surgical interventions come into play. There are several surgical procedures available to address bunions, each varying in complexity and recovery time. The most common type of bunion surgery is known as an osteotomy. This procedure involves the surgeon making small cuts in the bone to realign the big toe and remove the bunion. Once the bones are correctly aligned, they are held in place with screws or pins. Another surgical intervention is arthrodesis. This is typically reserved for severe bunions or for individuals who have had previous unsuccessful bunion surgery. In arthrodesis, the surgeon removes the arthritic joint surfaces, then inserts screws, wires, or plates to hold the surfaces together until they heal. A less common procedure is known as exostectomy, which involves removing the bunion from the foot without aligning the big toe. This procedure is rarely used alone as it does not address the underlying cause of the bunion and therefore has a higher chance of the bunion recurring. Lastly, there's the resection arthroplasty, used mainly for elderly patients who have had previous unsuccessful bunion surgery or have severe arthritis. This involves removing the damaged portion of the joint, which allows scar tissue to fill in the gap and create a flexible joint. These surgical procedures are usually performed under local anesthesia, and most people can go home the same day. Pain and swelling are common after surgery, and full recovery can take weeks to months. It's important to note that bunion surgery should not be undertaken lightly. It comes with potential risks and complications, such as infection, nerve damage, and the possibility of the bunion recurring. Therefore, it's crucial to discuss all your options with your doctor or podiatrist. They can provide advice based on your individual circumstances, including the severity of your bunion, your age, and your general health. Surgery can provide a more permanent solution, but remember, it should always be a well-informed decision. So how do you decide the best course of action for your bunion problem? When faced with a bunion problem, it can be difficult to know what steps to take. The first and most critical step is to consult with a specialist. This could be a podiatrist, an orthopedic surgeon, or a rheumatologist. These professionals have the knowledge and experience to accurately diagnose your condition and guide you through the decision-making process. The specialist will likely start by asking about your symptoms, conducting a physical examination, and may also request imaging tests such as X-rays. These steps will help them understand the severity of your condition and the best course of treatment. Once your condition has been thoroughly assessed, the specialist will discuss with you the pros and cons of each treatment option. If your bunion is not severe and does not significantly interfere with your daily activities, they may recommend non-surgical remedies. These could include wearing appropriate footwear, using orthopedic inserts, and performing specific exercises to strengthen your foot muscles. However, if your bunion is severe or if non-surgical remedies have not provided sufficient relief, the specialist may recommend surgery. There are different types of surgical procedures for bunions, and the specialist will explain each one, including the expected outcomes, potential risks, and recovery process. This is the point where you come in. The decision to opt for non-surgical remedies or to undergo surgery ultimately lies with you. You should consider your personal circumstances, lifestyle, and preferences. For example, if you lead an active lifestyle and the bunion is limiting your activities, you might lean towards surgery. On the other hand, if you prefer to avoid surgery, you might opt for non-surgical remedies and lifestyle modifications. It's important to take your time, ask questions, and make sure you understand all the information provided by the specialist. Don't hesitate to seek a second opinion if you're not sure, or if you want to confirm the initial advice. Remember, your health is paramount, and the decision should always be yours, made in consultation with your trusted doctor. Dealing with bunions can be a challenge, but with the right knowledge and support, you can overcome it. Today, we've explored the world of bunions, from understanding what they are and their causes, to the wide range of non-surgical remedies and surgical interventions available. We've emphasized the importance of consulting with a specialist, as your unique situation calls for a personalized approach. Whether you're considering orthopedic inserts, specific foot exercises, or even surgery, make sure to discuss these options with your doctor. In the face of discomfort and pain, it's heartening to know that there are ways to alleviate the situation and reclaim your comfort. We hope that this video has provided you with valuable insights and options. Feel free to share your experiences or ask questions. Your journey could provide comfort and knowledge to others facing similar challenges. Thank you for joining us today. Remember, your health is invaluable. Until next time, take care.